Hi, I'm Joe Massad, and I hope you will tune in on May's issue of dentistry today. My article entitled Treating the Patient with Inadequate Restorative Space, I think it is very, very germane today. Many times I see cases that come in who have implants, and I'm looking at the lower, and the patient's kind of complaining maybe they get food, and well, that's normal. But then I take a look at the height of the lower incisors, and they may be sometimes as much as 10-15 millimeters above the resting lip position. Well, you can imagine what the occlusal plane looks like on these cases. And then I'm thinking, well, I need to really drop these down. And then I look and there's no room. And that's because we did not measure the space prior to implant placement. It's a definite thing that we all need to do. And all we are going to do is we're going to measure, if you're a edentulous, for example, getting ready to have implants done, the ridge crest. So you have the maxillary premandibular ridge crest to the lip at rest and smiling. Same thing with the upper. I want to look at the ridge crest of the maxillary ridge, right, and measure how much distance I have with the lip at rest and the lip smiling. And once we do that, then we have these numerical numbers, and there's a formula which you'll see in the article, that how much space do you need for overdenture with studs? How much do you need for a bar case? How much do you need for the fixed or a hybrid case? And I think these are very, very important that we all understand this, because we get caught having problems like this. It's tough. And so I'm going to explain in this particular article a case that I did diagnose correctly. It was diagnosed right, but unfortunately I didn't know the surgeon who was putting in the implants, and he actually put in bone graft procedures and built the ridge up. And by the time the implants were placed, I only had 4 millimeters or so of space. And so you'll see how I had to negotiate that particular case. Tough case to do. It was out of my hands, and I want you to make sure you are always involved in all of these cases. See you again. Thank you.